Hi, this is Dr. Paul Goldberg at the Goldberg Clinic. Today, September the 2nd, 2016, we're here with Christy Ann. And Christy is from Seattle, Washington. She was referred to us by two excellent chiropractors in Seattle, Dr. Schuyler and Dr. Mosley, who are a husband and wife team of chiropractors in Seattle. And Christy, what brought you to the Goldberg Clinic?
Well, I've been seeing Josh Scheidler for the last year, and I've been telling him about the chronic pain that I've had for at least 5 to 10 years.
Yeah.
And he's been working with me. I hadn't been improving as much as he'd like to see me improve, and his recommendation was for me to see you guys, because what he was thinking is that I had chronic inflammation in my body, and I wasn't going to adjust very well if we didn't take care of the underlying issues.
Yeah, well, he and Dr. Mosley are wonderful chiropractors, and they like to see patients get down to the source of their problems just like we do. You'd had some medical care prior to that. You'd been under medical supervision. What kind of medical diagnoses had you received?
So my rheumatologist basically gave me the diagnosis of fibromyalgia and spondyloarthropathy.
Okay, fibromyalgia, which we refer to kind of as a garbage can diagnosis because it means the doctor doesn't really know what's going on. And spondyloarthropathy, because you had pain in your low back and your sacroiliac joints, and so they were looking to see hopefully what was causing that. You had been under some pharmaceuticals. What had you been taking for the discomforts? What had the medical doctors prescribed for you?
So I hadn't seen an orthopedic surgeon for my knee, and he had me on Celebrex.
Okay.
So I was on Celebrex for about 3 years, and we eventually took some blood tests and realized that at that point that my kidneys were being affected by the Celebrex. The Celebrex was helped me tremendously. It's like I didn't have any pain whatsoever.
It killed the pain, but it gave you kidney issues.
Yeah, so went off the Celebrex, and at that point, I had tremendous pain in all my body. I got tendonitis in my arms and my shoulders.
So wait a second, you were taking Celebrex, you didn't have any pain, but it turned out it was just masking, the pain was still continuing.
Exactly.
And you got kidney issues as well.
Yes.
Okay.
So at that point, that was probably, I'd say about 5 years ago. I was in so much pain that I went and saw the rheumatologist at that point. And so then we tried many different medications. Some of them were also affecting my kidneys, so they finally put me on Cymbalta. The interesting thing about Cymbalta is I didn't think it was helping me because I wasn't having a lot of pain, but I was still having pain. And so when I had knee replacement surgery last year, and for some reason I was thinking that...
And that was a result of an accident.
That was from a 30-year-old injury playing basketball in high school.
Okay.
So I was going to have knee replacement at this point, and I'm thinking, well, you know what? I'm probably having, once I get rid of my issues with my knee, all the inflammation in my body is going to disappear, and I don't need to be on Cymbalta. So I started going off Cymbalta at that point, right before my knee surgery. And so I'm not on Cymbalta any longer. I have the knee replacement. They put me on Percocet, and Percocet was helping again, just like the Celebrex. I wasn't having any pain, but as soon as I didn't take the Percocet, I couldn't get out of bed.
Was it difficult to get off the Percocet?
I couldn't get off the Percocet. As soon as I tried to, I had severe pain in my whole body. I couldn't get out of bed.
So your pain was again just being masked.
Exactly. And so went and saw the rheumatologist again, told her I went off the Cymbalta, and so they put me on prednisone. And prednisone took all the pain away, so I can get off the Percocet. So now I'm on prednisone, off the Percocet, and as soon as I go off the prednisone...
You're kind of playing musical chairs here.
Yeah. So once I get off the prednisone, then the pain comes back. And so that's when I'm seeing Dr. Scheidler and Dr. Mosley, and they are telling me about the Goldberg Clinic. And again, I need to go see you guys, try to get to the issues, what's causing all my pain, and get off all the medication.
Okay, so we saw you about 3 months ago, about
Yes.
the time we started on the program.
Yes.
What's been the result? 3 months, mostly under Dr. Tedder's supervision.
Yes, correct. Well, I'm off all painkillers. Don't need any painkillers whatsoever. I'm slowly trying to reduce my Cymbalta. It's difficult. You have to be careful when going off Cymbalta. So I'm taking that very slowly.
But you're reducing the dosage.
Yes, I am. So
no more prednisone.
No more prednisone.
No more
painkiller,
Percocet.
No more Percocet.
Excellent.
But mainly, I think it's a lifestyle change that you guys have helped me with. And the interesting thing also is that I've lost 22 pounds in 3 months without dieting.
22 pounds lost in 3 months with no dieting. And you
Correct.
know, we never put people on weight loss reduction programs because if you do the right thing, as you have done, those that need to gain weight will gain weight. Those that need to lose weight, lose weight.
Yes.
How's your energy level?
It's much better. I'm getting a lot of sleep, which is good.
Good. And overall now, in those 3 months, we have about what percentage improvement?
I would say at least 75%.
Excellent.
Mm-hmm.
Good job, Dr. Tenner, by the way. And good job, Christy.
Okay.
All right, thank you. You're going to take a little trip up to, was it North Carolina, South
We're
Carolina?
going to South Carolina.
South Carolina.
Charleston, South Carolina for the week, and then we'll be heading back to Seattle.
All right, we'll give Dr. Scheibler and Mosley our regards,
Yes.
and thank you for the excellent work you've done. We look forward to getting rid of the other 25% as well now.
Yes, indeed. Thank you.
Thank you.